My name is Betty Lynn Fisher. I'm the consumer reporter and columnist with the Akron Beacon Journal, as well as the medical reporter. And I'm here today with Dr. Matthew Nivsek. Did I say that right?
Yep.
Okay. Family practice primary care physician with Unity Health Network and practices in Hudson. So thank you so much for meeting with me via Zoom, kind of so quickly on short notice on a timely issue that some people, especially if you are suffering from seasonal allergies, something that people really want to know about. I posed the question on Twitter and Facebook and asked readers what questions they had for you. So let's go over a couple things that some people were asking. So some were asking about kind of any alternatives or the neti pot. What do you think about that?
Yeah, I think the neti pot's a great option. Anytime you can get away from using even over-the-counter or prescription meds, for sure, it's going to be something that's recommended by primary care docs, for sure. So I've had a lot of patients that have come in for sinusitis, so just nasal congestion, and we end up getting into a conversation of which type of sinusitis is this. A lot of patients want to at first go straight to this is a bacterial sinus infection and need antibiotics, but there's a lot of other reasons for sinus trouble, including viral, which will typically resolve on its own. You can use more conservative therapies, and then allergic sinusitis, especially this time of year, is highly prevalent and doesn't need to be treated with antibiotics, but can be treated with more conservative measures like a neti pot. There's all different types, so everybody kind of backs away from neti pot at first because it seems to be highly intolerable, basically pouring water into your nose, okay? But there's bottles that can be used to squeeze in the nose. There are different delivery devices, and those can be found over the counter as well, just to finding something that you can tolerate well.
Okay. Are there other alternatives that you've heard patients kind of rave about or think that it works pretty well?
Yeah, there are. I try to stick with more of a nasal saline type regimen, neti pot regimen, because we know that works and it's not necessarily harmful and you're not going to create med interactions with a neti pot. But some patients will use silver biotics, which is a type of homeopathic alternative medication. There's immune boosters, so trying to keep the immune system as healthy as possible and to be able to respond appropriately is a very common option as well.
Okay. And the neti pot, is that like once a day at night, or does it matter?
Not necessarily, just have to watch for nasal irritation. Okay. It can be used once or twice a day to start, and then if needed to be used more frequently, it certainly could. I just ask your primary care doc first, whoever you're working with on treatment plan.
A suggestion from a reader was if you're not allergic to bees, to find local bee pollen and put that into your meals in the morning, or perhaps local raw honey. Could that help at all?
Yeah, it can. It's not something that I'll usually recommend as first line. It's got a good theory behind it. It's pretty much similar to a theory of using immunotherapy. So you're exposing the body to a small amount of a potential allergen or area, sensitizing to it, and then decreasing that allergic response.
And that's assuming that probably whatever the pollen that the bees are pollinating is what you're allergic to.
Right. Okay. Yeah. So you're giving the body a small amount of that potential allergen, and then the reaction or response from the body would be less. Okay. So it's a desensitizing type procedure.
Okay. I had one reader ask about whether over-the-counter medications could affect her eyesight, and I did do a little bit of back and forth, so this may be really pretty specific, so we might have to back up and just be more general. But she said it wasn't watering her eyes or blurring, but that it actually kind of made her eyes lose some focus, and she had gone to an eye doctor, and they said it wasn't that. So she just wasn't sure. She said she's read some stuff, and she was just concerned about whether her eyesight could be affected by allergy medicines or allergies.
Yeah. So anytime that you're taking, so it would be important to know which med it was first, but generally the whole class of an antihistamine taken orally, so it's going systemically throughout the body, it could create side effects.
Okay.
And that's one of the reasons that you want to go more so with a nasal spray or eye drop, if that's where your symptoms are, because when you take an oral medication or a systemic medication, it can create there's more potential for side effects.
I gotcha. Not going directly to what you need. So maybe
Yeah.
for her, she really then specifically if she's having problems, she should try the nasal sprays maybe.
Yeah, nasal sprays or eye drops. Yeah.
Another reader was saying that her son is sleeping upright on the sofa because he just can't get any comfort at night. I'm assuming that's just for drainage, that he just doesn't want to lay back. And any ideas for comfort there?
That could, yeah. So it certainly could be post-nasal drainage, and that creates a lot of irritation in the back of the throat. So a nasal spray can be utilized to help directly treat that problem. Sometimes a humidifier in the bedroom or wherever you're sleeping can also help to moisten the airways and make it a little bit easier to breathe.
Gotcha. Another one asked, what times should you take your medicine? Is it better to take some in the morning and at night? And then I think we already answered this one. Can you put a spray and a pill together? And the answer to that is yes. So what about timing of when you should do this?
Yeah. So generally how I direct that treatment approach is based on how much the oral antihistamine is going to create the potential side effect of fatigue. So like we talked about earlier, there's less potent antihistamines, medium potency, and then high potency. High potency being Benadryl, which will make the majority of patients tired. That one should be taken at night if that one needs to be utilized. The other medications like Claritin and Allegra, the less potent antihistamines, can be taken during the day. And generally, most patients can tolerate Zyrtec or Xyzal during the day as well. But if it does create fatigue and there's that side effect, taking it at night is okay as well.
I'm gonna actually throw one in here for
That's fine.
Question. So when my son was having his flare-ups a couple of weeks, when he's in the middle of an attack, oh my gosh, he can't get the medicine fast enough, right? But then it's every 4 to 6 hours, and sometimes he's like, I'm fine, I don't need to take it anymore. So what's the importance of maybe even during like a 3-day period, should you continue it to like make sure it doesn't go away a little bit and then come back, or just do it as needed, but then sometimes it's too late because when you need it, the attack come.
Yeah, never really know when this is gonna hit. So taking after, like, if you're in a flare and you need to take the medication to help treat the flare, it's almost too late a little bit. We talked about prevention, but we have to do something to treat the problem. And then it would be a good idea to take the medications rather than as needed, take them as scheduled for a short period of time, whether it be, justify it with yourself and based on how your symptoms are. But a week after a flare or 2 weeks after a flare, taking an antihistamine generally is not going to create much other side effect. So it's just a matter of how long you can tolerate taking that medication and how long you really need it to treat symptoms.
So and then really, you should keep it through the flare and not necessarily like for the whole month of June or July. Right?
Yeah.
Especially if you're doing the stronger ones.
Generally to keep taking medication through the flare and then maybe a week or 2 afterwards. And then if symptoms recur, then can add that back in.
Okay. And then what about sinus pressure? So sometimes, like we've got the drainage, we've got the nasal congestion. And then does it just depend upon where that congestion is when you then instead are getting just this horrible headache or the eye pain?
Yeah, that's a good question. We have different sinuses. So located more on the forehead, frontal sinuses. You have maxillary sinuses where a lot of issues develop there. So to treat that, it's harder to get to the frontal sinuses and a little bit easier to get to the maxillary sinuses with nasal spray or a neti pot. But generally, I see a lot of patients use nasal sprays the wrong way. Generally, when you use a nasal spray, you want to aim the nozzle towards the outside of the eye, spray it in, lightly sniff. If you sniff too much, then the nasal spray goes down the back of the throat and actually doesn't get into the sinus. So
Oh,
I have a lot of patients using nasal sprays, saying they're using it, it's not working, but it's just being used incorrectly.
well, they're sniffing too hard. You got to do a
Mhm.
light sniff so it goes up as opposed to back.
Right.
Okay.
Yeah. So if you sniff in too hard, the nasal passages and down the back of the throat is connected, so it's just going to go right down the back. So generally, I say to my patients, if you taste nasal spray, it wasn't used correctly, so it should sit
Oh,
in the sinus for the majority of
okay. And do
its
it
administration.
sitting up or standing up? I mean, you want to be upright when you're doing this?
Yeah.
Okay.
It's as long as it's not dripping down the back of your throat and you're not sitting too hard, and that's generally how it should be used. So leaning forward a little bit and a light sniff should be enough to keep it in the sinus, but not go down the back of the throat.
Okay. Okay. We touched on this real quickly before, but let's just do it
Mhm.
one more time. So, someone said that there's medications that she's worried about because of her blood pressure. So does she, I think I saw some at the store with my dad once that, I mean, you can get a decongestant that's like, I can't remember the initials, but it's something that specifically for folks with high blood pressure?
Yeah. So it's almost like a Sudafed for those with high blood pressure. It's called Coricidin, HBP.
Okay.
So that's a safe medication for anyone with already having the diagnosis of hypertension or high blood pressure.
So that's like, that would be the equivalent of a Sudafed decongestant.
Mm-hmm.
But
Yeah.
but that's what they should be getting instead of the Sudafed D.
Right. Yeah. I tell my patients to use that. Those that have high blood pressure use that over anything that says D at the end. So Allegra D or Zyrtec D.
Okay.
Use the generic first, Zyrtec by itself or Allegra by itself, for example, and combine it with Coricidin if the decongestant is needed.
Gotcha. Okay. Okay. So they can take the lower things by themselves. It's the decongestant part that you're worried about. Okay. Going back to the nasal spray thing, is there a difference between, it's been a long time since I've had some nasal sprays, but I know some of them are more liquidy and then some of them are more misty. Is there a difference or just preference?
Yeah. At that point, as long as you have the right type of nasal spray, so steroid nasal sprays are going to be the most effective if tolerated for allergic rhinitis or allergies affecting the nose. But generally, a mist versus a different type of solution is not the biggest deal.
Okay. Okay.
So,
great.
Yeah.
Well, thank you so much for your help. I really appreciate it. I'm really glad that we were able to do this. And like I said, hopefully we can give people some relief this allergy season.
Of course. Thank you so much for having me. Appreciate having me.